Thank you, Dr. Cheran, for talking to Kowai Post. Doctor, you are a urologist. You've been seeing a lot of patients in your hospital. Tell me, what are the most common kind of problems that patients come up with?
Most probably common problems being the first one being the stone disease.
Okay.
Ours being a tropical climate where the sun is very hot and people do present with a lot of stone problems.
Kidney stones.
Yeah, both kidney stones as well as ureteric stones and bladder stones.
Okay.
Basically, all the stones are formed in the kidneys. They stay there without causing any problem initially. Later on, when they come down, they can either block the urinary tubes or the bladder.
Okay.
And cause pain, major problems like pain, urinary infections, blood in urine and stuff like that.
Okay. So what else, doctor? Kidney stones is one, and I think urinary tract infection is also very common.
Yeah, that's true. Actually, following stones, most common ones are the second in the list comes the urinary tract infections.
Okay.
It affects both men and women, but women are more prone for the urinary tract infections.
And what is the reason, doctor?
Basically, it is one, the anatomy or the urinary passage.
Okay.
That is the urethra, which is connecting the bladder to the exterior, is very short in females. It's only 4 centimeters.
Okay.
So almost 90 to 95% of urinary infections is from outside. Contamination from outside, which enters the urine from outside.
From outside.
So since it's a very short length of the urethra in females, they can easily catch up urinary infection, whereas in males it is a long urinary passage which is about 20 centimeters.
Okay.
So before the organism can enter in, it gets flushed out.
Okay.
This is one reason. The second one common is being the habit, holding habit of the women. They don't pass urine outside. They have to get back home to work. So as they hold urine for long, the bladder capacity gradually increases and the tone of the bladder comes down. So they don't empty effectively. And this again, the longer duration of storage, the urinary bacteria tends to ascend up through the urethra from outside in, and that's another secondary cause.
So this also is because one doesn't drink enough water?
It's not like that. We do want all people to drink enough water and pass urine in the regular intervals, so that you form enough urine, you pass out enough urine at right intervals of time. So that can avoid a lot of infections.
So doctor, we were talking about stones. So how many cases really do you get in your OPD, and what do you think such patients should what is the warning signs and what should they do to prevent it?
When you talk about stones, actually the presentation is every third or the fourth patient who walks into the OPD presents with the stone disease. The classical symptoms what they present with is pain in their loins, and some patients, not all symptoms are applicable to all patients. Some patients present only with pain. Some present with pain associated with a burning sensation while passing urine, or some associated blood in urine as well.
Okay.
So when these patients come in, based on the symptoms, we evaluate them as investigation like an ultrasound or a CT scan based on the necessity. And once the stone is confirmed, so we have to plan the management based on the position of the stone, the size of the stone, and other associated complications which they present with. So if for example the patient is having a stone in the ureter, that is a tube connecting the kidney to the bladder, we have something called the ureteroscopy, a rigid scope where we go inside through the normal urinary orifice, go in, find the stone, basket it, fragment it with either a lithoclast, a pneumatic instrument, or a laser. And we fragment it into fine fragments.
Breaking the stone.
Yeah, that's true.
Yeah.
So we break it into fine fragments and we retrieve it.
Okay.
That is for the ureteric stones. If it is a renal stone, which is a stone within the kidney which is very big, there we have two techniques we have. One is a non-surgical one called ESWL, extra shock wave lithotripsy. So where we pass waves from outside.
Waves. Okay.
Yeah, basically it's sound wave, pass from outside and we blast it This is actually a non-surgical one, which is available in our hospital.
Okay.
Not all centers do have it.
Okay.
This is only very few hand-selected centers have it here in Coimbatore.
Okay.
And the advantage of this is it's a non-surgical one. No IP admission is needed. It's a daycare procedure. But the disadvantage of this is this: it can break less than 2 centimeter stones and soft stones.
Okay.
Not applicable for hard stones and stones more than 2 centimeters.
Okay. Okay.
So this is one modality for kidney stones.
Yeah.
The other one being RARS, that is retrograde intrarenal surgery, where we use a flexible ureteroscope, go in through the normal urinary passage, using laser, dust it, make it into fine dust, and radiate remote. And this is also applicable for stones less than 2 centimeters.
Okay.
There's a third modality as well, which is for larger stones more than 2 centimeters. It's called PCNL, percutaneous nephrolithotomy, where we make a very small hole through the loin, enter the kidney, and break the stone into fine particles and remove them.
Okay. Dr. Loin is what?
Loin is the flank, the side,
Okay.
where the kidneys are located.
Okay. Okay. So, doctor, what are the issues that the elderly come to you with?
Yeah, talking about elderly, patients who commonly present are elderly men. It is basically because of the prostatic enlargement. Prostate is a small shield-shaped organ which is located just below the bladder on the passage of the urinary tract. So what happens is this prostate is present only in men, and women don't have it.
Yeah.
So women are kept out of it. So these men, after age of around 40 years, this organ starts to grow slowly.
Okay.
So as it grows over the years together. So what happens as it grows, it starts to occlude the lumen of the urinary passage, causing them urinary problems. Like their common presentations will be the stream of urine starts to become slow.
Okay.
Gradually over the years it becomes slow and slow, to a point that some patients they're not able to pass urine.
Yeah.
They go
And
for
there's
retention.
pain also.
Yeah, with associated abdominal pain as well.
Yeah.
The second symptom they will have is some burning sensation when they pass urine. Only they will have burning sensation only when they pass urine.
Okay.
The third symptom will be frequency. That is, number of frequent times that they have to go to the loo increases.
Yes.
And next symptom will be increased frequency during the night time. For example, some patients even for every 15 minutes they go to the loo to pass urine. These are some of the symptoms that they present with, and some they will present with blood in urine.
Okay.
And these men, they are more prone for urinary infections as well, because the urine doesn't empty fully. Whenever we pass urine, we should empty it fully. In these patients, because of the blockage in the passage, they tend to hold up urine inside. So when they held up urine, automatically they're prone for infections and other complications.
Okay, so how do they avoid it? I mean, you said this is an organ growth, so nothing much can be done about it?
There is nothing called prevention here. Exactly, the thing is, it is a natural phenomenon.
Yeah.
All men, as we grow old, it happens.
So what percentage will end up with prostate?
You mean prostate problem?
Prostate issues, yeah.
Almost 70 to 80% of them they will have symptom at one point of time in their life.
70 to 80%.
Yeah,
Okay.
there are very few patients who will not have much of symptoms.
Okay.
So these patients, when they have symptoms, they can be managed based on their symptoms. Minor symptoms can be managed with medications, and little more severe symptoms, they will need surgical relief of the obstruction.
Okay.
It's called the TORP, where again endoscopically we remove the blockage so that create the normal passage again, so that they can pass freely.
Free flowing,
Yeah.
Doctor, when it comes to children, what are the issues that you are seeing?
In pediatric age group, more or less like adults, they also present with stone disease. They also present with urinary tract infections, and the most common ones who present with the patients with something called posterior urethral valve, where there is an outlet obstruction in the urinary passage from the bladder to the outside. So these patients actually most of them
they have problem passing urine.
Yeah, correct. Actually, these children, they are diagnosed even before birth, that is during their antenatal period, in their antenatal scans.
Okay, that's interesting.
Yeah, here we can see that the bladder is over distended, and amniotic fluid is also less, and something like that. So, and these problems can be detected antenatally, and if necessity can be also corrected antenatally, which is very not done routinely done in our country, but abroad they do. Fetal intervention as well. And once within these patients, once they are born, immediately we assess their renal parameters, the lung development, all those stuff, and we do a procedure called valve fulguration, where we endoscopically fulgurate, remove the valve, so that they can pass urine freely. So these patients, since it is for a long duration from even internatally, they can have bladder function problems later on in their life. So they should be on regular follow-ups. This is one of the commonest problems what we face in pediatric patients. The other problem what we face is hypospadiasis, where the normal opening is not in the normal position. It is abnormal somewhere. So likewise, all can be corrected, which we regularly do in our center.
So doctor, can we talk about malignancy? What is how many people with cancer really do you see, and what are the kind of cancer patients, what are the kind of cancer that they come up with?
And talking about malignancy, it can, especially urological malignancies, it can start from the kidneys, the tubes connecting the kidneys to the bladder. The bladder malignancies are there, bladder cancers are there, and cancers of the urethra, that is the tube connecting to the exterior, are also there. The most common presentation, what they present with is, all these patients, most of them will have blood in urine.
Blood in urine.
So, blood in urine is not only malignancy, it can also come in stones and infections as well. But whenever there is blood in urine, always the first point you'll have to rule out is a malignancy there. So a patient with a kidney malignancy will present with abdominal pains, blood in urine, or some vague symptoms like burning sensation while passing urine. Whereas the patient with a bladder tumor will present with, again, blood, painless, no pain in the abdomen, but blood and clots in the urine. And sometimes without even blood, they can have some burning sensation around in their urine.
And this is for both men and women?
Yeah, it is common for both men and women. Malignancies, especially for only in men, are prostate malignancies. They will present typically like a bladder outlet obstruction due to a benign problem, that is benign enlargement of prostate. The symptoms will be more or less the same, like increased frequency of passing urine, number of times they pass in the night will be more, burning sensation when they pass urine. Symptoms will be the same. But this is basically a diagnosis of exclusion. We are regularly, when we see them, a rectal examination, we do check for the prostate if there is abnormality there, and we do a test called PSA, prostate specific antigen, which will be elevated in malignancies. So if these two are there, when a clinical suspicion associated with the elevated PSA, then we'll have to rule out prostatic malignancy. What we do is we take a transrectal biopsy of the prostate, which will confirm whether malignancy is there or not.
So these cancer patients, what are the kind of stages that they come to you in, doctor?
Actually, the presentation varies. Some patients, they don't have any symptoms. They are detected incidentally when they come for a mast cell checkup. That is another one emphasis for a mast cell checkup, actually, because they don't have any symptoms. Suddenly, one fine day, they will present with symptoms when they are in an advanced stage, where nothing can be done. When these mast cell checkups, they help us detect malignancies at the early stage. When these patients, without any symptoms at the early stage, when they are detected, it is completely curable. So it can be completely removed, and they are disease free. And as we said about malignancies, these can be managed either by traditional open method, or the latest ones, like the keyhole surgery, laparoscopy. Our center has best laparoscopic surgeons in the state and the city, and we do all laparoscopic surgeries here, even for both benign and malignant conditions.
So doctor, let's now talk about kidney failure. What is the stage in which a patient needs to go for transplant, and until what stage can he do with medication?
Yeah, good question. Actually, renal failure is based on the amount of output they put out. It's called, we calculate something called the GFR. glomerular filtration, the amount of urine the kidney produces. So these patients with renal failure, up till they come to a stage where they cannot excrete their waste products outside. That is about when the GFR falls to less than 30 ml per minute. So that means they are in a state where the kidney damage is irrecoverable. That is, they cannot manage by themselves. And in these patients, they usually go on dialysis. So dialysis can be done until they can manage on dialysis.
But it's an expensive procedure.
Yeah, it is not only expensive, it also has its own drawbacks. It has increased pressure on the hearts and the circulatory system.
Okay.
So whenever possible, when the kidney function is irrecoverable, less than a 30 ml GFR, it is better to go for a transplant where the the strain on the body is less due to the dialysis, the heart, especially the heart, and these patients, they tend to have a normal life, what they had before the renal failure.
So doctor, now that we're talking about transplant, how is the supply or demand supply of organ? Are you having issues there?
Worldwide, worldwide actually demand is more, but the supply is less. Actually, there are two kinds of donation. That is, one is a living donor program, and another is a cadaveric program. Yes. Abroad, the cadaveric program is very well enlisted. Even there is a demand is more, the supply is less. Here there is, even though we have a good set of organizations monitoring this, the society is not yet tuned up for organ donation. Right. So the demand is really more and the supply is very less. So in our center, actually we have started renal transplants, and we are in the pipeline of doing both living donor as well as cadaveric.
Okay. So doctor, do you also see cases with fertility issues and sexual dysfunctions? We urologists are also andrologists. We also cover male sexual dysfunctions as well as infertility problems. So we're coming to sexual dysfunctions problems, patients commonly come with erectile dysfunctions as well as premature ejaculations. And some patients even come with anejaculations, where semen doesn't come out. Okay. And when talking about infertility, we do treat with patients with primary infertility, where they have not had children at all, and patients also with secondary infertility, where they already had a first child and they are trying to conceive for the second one. They have issues there. So we urologists and come from andrology, we treat with these patients. We treat for the male infertility problem. So what is the percentage of success rate, doctor, as far as infertility is concerned?
See, we're talking about infertility, it is 50% male factor and 50% female factor. Right. So even if the fertility of one partner is very good, it will compensate for the other. Okay. So it is a combination of both male and female factors together. So can't particularly say about one factor alone, talk about one factor alone.
Okay. So thank you so much for talking to Kowai Post, doctor. Thank you.
And thank Kowai Post for giving the opportunity.
Thank you.
To get instant news updates, like the Kowai Post page. Click on See First to view the news first. Also, in YouTube, subscribe to Kowai Post channel to watch interesting news and videos.